So I'm continuing to do some work on the sacroiliac joint. One thing I learned after leaving school was sometimes the problem isn't on the opposite side of the body. So if you had a problem here, the opposite side would be there. Sacrum, abdomen, pelvis. And this is verified by stuff I've read in Visceral Manipulation. The descending colon, small intestines, ureters can all have a factor. Think about it. If you have a very delicate part of your body that's sensitive, you will do everything you can to protect that at the cost of everything else around it, in which case, if we have an issue here, sacroiliac may take the hit. So that's what I'm going to do. My client, I've done this work on her a number of times and she keeps on coming back. So this is why I'm thinking, let's try working on the front, unless it's a repetitive action that she's taking. So, first one I'll do is the ureters, because when I did general listening, it indicated there may be a problem with the left kidney, and the left kidney relates to pelvic problems, right to the lungs. Okay, so 2 fingers to the side of the pubic bone. So I'm going to, there. So that's the path of the ureter. So I'll pull these 2 apart and challenge it and see what I feel. So assess before treat. One thing you can do when you challenge it is vibrate one of your fingers. If you immediately feel it at the other end, it's tight. If you don't, it's slack, that's good. Okay, I can feel there's definitely a connection in there. So I'll just pull it apart. Okay, there's some motion, this is good. There's a midpoint where the ureter passes over some vessels, and that can be a sticking point. So I've just grabbed that area. I'm just trying to do a fascial glide, slide. When the client breathes, every breath pushes the kidney down, but the motion of the ureters is only near the top. And with all visceral manipulation work, you don't force it and you don't do too much. Okay, so I'll stop at that point for the ureter. Now I'm going to work on the large intestine. I'll just sink my fingers in. Okay, and I can feel it. It will change, depends on their GI activity. So a little pressure against the descending colon, and I'm gently pulling it down. And now change direction. I'll just pull it up. It turns into the sigmoid. I'll work on that next. Okay, let's get a bit closer to the sigmoid. The sigmoid's at the back of the pelvic cavity, right up against the sacrum. So any adhesions, attachments here would certainly have an impact. I'll just check the small intestine, because that's in the area there. And the small intestine swirls, and at some point you'll see my hand following the pattern. There we are. I'm just enhancing it a little bit. When it slows down, I keep on going just a little bit further to encourage it. I'm going to finish with a maneuver which will help pull on the small intestines. You'll see. Okay. All right. That's for the abdomen. The psoas. It's a muscle. It's right underneath there. Heads down in this direction. Crosses over the sacroiliac junction, can pull these two together, so certainly can have an effect there. So what I'm going to do now is have the client stretch her psoas. And let's see, first off, I want you to move to the side of the table, just to the edge. I'm going to take the pillow out, and I want, actually, bend your knees, push this, lift your butt up a bit, there, good, that's it, right. There's a reason for all this. Okay, here we are. So this is to make sure she doesn't fall off the table. You hang the leg off, side there. Now, I want your torso to be moved to the opposite side, there, and try to turn a little bit so you're facing this way. Good, perfect. I'm loading the psoas because it's more than one function, more than one direction. It's a three-dimensional. Right. So I look, two factors. If the heel is forward of the knee, then the thigh is tight, and then we're pulling on the pelvis. And right now it's perfect. Good. If the knee is high up, like it is now, that suggests there's an issue with the psoas. If it was low down, no issue. So what I'm going to do is gently push on it. One more loading. I'm going to use my leg and just hold her foot out a little bit. That inwardly rotates the thigh, further loading the psoas. And then gently push down. This has to be a slow technique. because the psoas is a postural muscle and a psychological muscle. By postural, I mean under stress, it has to stay tight. It would, think back to, let's see, when we were living in trees, eating bananas, stuff like that. If this muscle gave out, then we wouldn't be able to run. We're just going to fall over. So it stays tight under stress. Psychological, because it's the first muscle that kicks in for fetal positioning. So babies do it a lot. Anything stressful, they curl up. So any stress embedded in there, the client probably doesn't know what it is, will just feel stressed. And in releasing it, the stress may come out abruptly. It's happened before, and when it did, I just backed off to the edge of the room and sat down, looked as least threatening as possible, and talked with the client until the episode worked away. And she had no idea what it was, and that was fine. I explained why that would be. All right, so I've been applying gentle pressure here. The knee has been moving a little bit slowly, so that's ideal. Let's just check to see how it is closer to the floor. It's flowing nicely. That's good. So that's the psoas stretch with the enhancements, twisting and turning. Right. Whenever you do visceral manipulation, you should end with this position. I'm going to ask my client to get on her forearms and her knees on the table, and so she'll end up in a slightly head down position, and I'm going to grab her abdomen and pull down and up, and what that's going to do is going to pull on the peritoneum, the wrapping around all these intestines, and where it's connected against the spine and the sacrum. So I'll be pulling on that. So I'll be doing it gently, because why not? But I'll be trying to feel if there's any attachments against the sacrum for any sudden releases. Reach around, squeeze that abdominal muscle, pull down, and gently pull up. And again, 45 seconds at least, while listening, feeling for any release. Already it's slowly moving, that's a good thing. Everything's moving nicely. So the first video, pretty standard, sacroiliac dysfunction. I'd worked on the client a number of times. He kept on coming back. So either it was a repetitive action that was causing it, or I hadn't found the problem area. And I'd learned that check the opposite side of the body. So the opposite side of the body would be the pelvis here. General listening, I'd found there's an issue with the left kidney, and the kidney connects with the pelvis, the right kidney with the lungs. So that matched. So I separated out anything that was tethering this here. So that was the ureter, the large intestine, and the psoas. And then to finish, like for all visceral manipulation, grabbed the peritoneum, the wrapping, while she was on the forearms and knees, and pulled down away from the sacrum. And that would have released any attachments and consolidated the work that we did today. So I'll check in with the client a week from now, and hopefully, that's it. Did the job. Thank you.